Hi everyone, Assalamualaikum. So today we are going to learn about flat foot. So let's get started. Okay, before we go deeper, let's learn the definition of flat foot. So actually, flat foot is the arc of the inside in your feet are flattened and allow the entire sole of your foot to touch the ground when you stand up. This condition, also known as past flatness, and it occurs when the entire sole come into contact with the ground. So it categorized by the loss of the natural arc in the foot, and this can be present from the birth or acquired later in life due to various factors such as aging, injury, or excessive wear and tear on the feet. So, common causes include ligament laxity, muscle imbalance, and condition like obesity. Plus, do you know that flat feet are a widespread condition globally and it affecting individual of all age of group? So for children, it estimated that nearly 20 to 30% of children have flat feet with many naturally developed arc as they grow. But for adults, the prevalence remains significant in adulthood, with approximately 25% of the adult population experiencing some degree of flat feet. Now we'll see the anatomy of the flat foot. So let's begin by discussing the normal anatomy of foot. So the foot has three arches. The medial longitude arch along the inner side of the foot, lateral longitude arc along the outer side, and the transverse arc that runs across the midfoot. So these arches are maintained by a delicate balance of muscle, tendon, ligament, and foot. So for the condition of flat foot, it's quite different from the normal. So let's explain one by one. So the arches of the foot, the medial longitudinal arch, we call it as MLE, run along the inner side of the foot from the heel to the ball of the foot. So its primary arc affected in flat foot. While in lateral longitude arch, or we call it as LLE, this arc run along the outer side of the foot. So for the ligament, um, this tendon support the arch and help stabilize the foot when walking. But for flat foot, it's sorry, in the individual with flat foot, the arches may not be adequate to support and leading to excessive pronated of the foot. So this can result from various factors including weak ligament, imbalance in muscle strength, or structural abnormalities in bone. Now let's discuss the causes of flat foot. The first one is genetic factor. So genetic factor play a significant role in development of flat foot. So if a child have a parent with flat foot, there are an increased likelihood of inheriting the condition. So the genetic can affect the structure and alignment of the foot arches. Next, aging and wear and tear. So, the natural aging process can result in the changes to the tendon and ligament and potentially leading to a loss of arch hit. So, aging related changes can contribute to the development of flat foot in some of individuals. So, the third one is injuries or trauma. Trauma or injury to the foot or ankle, especially if it involves the tendon and ligament that support the arches, it can lead to the development of flat foot. So the damage to supportive structure can compromise the foot ability to maintain the normal arc. And lastly, medical conditions such as arthritis or nerve problems. Alright, now let's discover the symptom of flat foot. So if you have any of these symptoms, please refer to the professional for medical help. So the first symptom is pain or discomfort in feet, ankle, or knees. So pain or discomfort along the inner side of the foot, particularly along the arch or heel, is common symptom of flat foot. So the collapse of arches can strain surrounding structures, leading to the pain during weight-bearing activity. So next one is swelling on the inside of the ankle. So swelling, or we call it as edema, is the inner part of the ankle or along the arch may occur due to the increased stress of the soft tissue. So the swelling is often a response to inflammation and can contribute to feelings of discomfort and heaviness. All right. Lastly, overpronation. So overpronation is a biomechanical issue where fluid rolls excessively inward during walking or running. So when combined with flat feet where the arc low is lower or collapsed, overpronation can be more pronounced. So flat feet are often associated with overpronation due to the lack of arch supports. So this can lead to the uneven distribute of weight and cause increased stress on certain areas of foot and lower leg. So it is important to note that not everyone with flat foot experience symptom. For some, flat foot may be asymptomatic. So, however, when symptoms are present and interfere with daily activities, so it advisable to seek evaluation and appropriate management from healthcare and professionals. So, who is at risk for flat foot? So, there are several risky individuals that can affected with flat foot. The first one is if it runs in genetics. So family history play a significant role. So if parents are close or close relative have flat foot, it has the higher um, probability to inherit this trait. So next is age. So, as individual ages, the tendon and ligament that support the arches may weaken and leading to a flattening of the foot. Next, obesity. So, the excess body weight can put additional stress on the feet that can contribute to development of flat feet. Next, pregnancy. So the additional week of hormone and hormonal changes during pregnancy can affect the structure of the feet and lead to flat feet. All right, not just that, people with injuries or trauma have higher risks for flat foot. So trauma to the foot, such as fractures or dislocation, can impact the arches and contribute to flat foot. Alright, next is connective tissue disorder. So the condition like Adler-Donner syndrome or Marfan syndrome, which affect connective tissue, may increase the risk of low flat feet. Alright. Next one is neurological conditions. So certain neurological condition or condition affecting the muscle and nerve may impact the normal out structure. Also risky is the person with rheumatoid arthritis, occupational factor, and the individual who wear improper footwear. All right, now let's discuss about the treatment and management of flat foot. So the treatment and management of flat foot typically involve the combination of conservative measure aimed at relieve the symptom and in some cases surgical intervention for severe cases. So here is four common approaches. The first one is supportive footwear. So it is advisable to choose shoes with proper arch support, with a firm heel counter and a supportive sole. So the stability shoe or those designed for overpronation may be beneficial. Next is orthotic insert. So custom or over-the-counter orthotic insert can provide additional arch support and help distribute pressure more evenly. So this insert can be worn in most type of shoes. Alright, next is physical therapy exercise. So physical therapy exercises can strengthen the muscle in the feet and leg and improve overall foot mechanics. So therapists may also use stretching exercise to address the tightness. Lastly, surgical option. For some severe cases that do not respond to conservative measure, surgical intervention may be considered. So the procedure may include tendon repair, bone realignment, or fusion or certain joint to provide stability. So it is essential to note that the management plan should be tailored to individual specific symptoms. So the severity of the flat feet and the overall health is important. So, consulting with a healthcare professional such as a podiatrist or orthopedic specialist is crucial for proper diagnosis and development of appropriate treatment plan. While some factors contributing to flat feet, such as genetic, cannot be altered, there are preventive measures that can help reduce the risk or severity of flat feet, such as those. The first one is maintain a healthy weight. Choose supportive footwear, regular exercises, avoid prolonged high impact activity, arc strengthening exercise, maintain flexibility, orthotic insert, monitor foot health, regular checkup, avoid going barefoot on hard surface, and choose low impact activity. So remember, prevention is not always guaranteed, especially if flat feet has strong genetic component. However, adopting these preventive measures can contribute to maintaining overall foot health and minimizing the risk of developing the flat foot. So, if there are concerns about foot structure or function, please consult with healthcare professional so that they can provide personalized guidance. So, in summary, flat foot involve the arches of the feet collapse. So, when the some causes are beyond our control, taking simple steps like wearing supportive shoes and staying active can help keep our feet healthy. So, if you notice any issue, uh, early intervention like use insert or doing exercise is the key. So please be noted that consulting a healthcare professional ensure the professionalized advice. So by taking care of our feet, we can prevent or manage flat feet effectively. So I think that's all from me. Thank you for listening. Assalamualaikum. Bye bye.